Good afternoon and welcome to this live webinar. I'm Andrew Naprotic and this is the 9th webinar in the Impact series brought to you by Practice Advisors 360. This series will cover COVID-19 related topics which are impacting the businesses of healthcare practitioners today. These webinars will be short, insightful and purposeful and will provide meaningful information relative to today's COVID-19 economic environment. This particular webinar will focus on marketing and specifically marketing considerations during this period of COVID-19. It will run for approximately 10 minutes, followed by 5 minutes of questions and answers at the end. I'm delighted to be joined by Pete Lukas. Pete is the founder of Practice Marketing and Communication. With more than 20 years of experience working in broadcast, digital media and marketing, Pete brings his unique experience to the healthcare industry, where he works closely with providers and practices to assess, define, and implement their medical marketing solutions. Pete, welcome to this webinar.
Andrew, thank you. I appreciate you having me, and I appreciate what you and Practice Advisors have done through this series. As a marketing person, I love marketing, but I've been fortunate enough to go back and watch each of these segments, and I think it's important to learn the different facets of the industry, and they've been very well done, so I'm thrilled to be a part of this.
Great, thank you. Thank you there, Pete. So let's talk about marketing. There's no question that in order to succeed, marketing is an important practice that all medical practitioners should adopt and consider proactively in their practice and business campaigning. How has the need for marketing changed during COVID-19?
Sure, Andrew, that's a great question. I get that all the time. How do we market now that the times have changed? But in some senses, it's actually never been better to market your practice or to be a marketer because you have an engaged audience. We're living in a different world. We're not moving around as much. We're online. We're engaged with what we see. Frankly, 80% of all internet users in the US at one point have searched for a health-related topic online. Of course, this applies to the dental industry, the orthopedic, orthodontic. So we know that there's an engaged audience out there. Now is our chance to get in front of them. If you haven't already gone online as a practitioner and gotten social, now is the time. You can't use that excuse that you haven't had time to do it because we've all had a little extra time. And really, as the face of your practice, you are the one that the patients are used to seeing. You want to remind them that you're out there, that you are thinking about their safety. That's the number one priority. I'll say it a few times during this presentation. Safety, safety, safety. You want to tell your patients and their families that we are making all precautions necessary so that when you come back to visit us, you'll have a safe experience. And so what can patients expect when they come back? Using video. If you haven't used your phone before, take your phone out and give it a try. When I started in TV years ago, you had to have a camera and a playback machine. Everyone has got that equipment in their pocket. So use a camera, use a phone, and give it a try yourself. Have maybe your family member shoot video of you in the office, what they can expect, do a little bit of a narration. I've seen videos from around the country of practice owners doing this themselves from Newport to California. And they're very engaging. It gives your patients a sense that you're still there. And it gives that personality that they're used to seeing, because when they come back in the office, they won't have as much time as they've had before. So just explain how things have changed, whether they'll be texting from the car when they arrive to contactless solutions when they come in, whether it's payment, signing ahead of time, waivers, things like that. Just give them an idea so they won't be surprised when they come back. More than any other industry, the dental industry has been impacted by the masks. You're used to seeing your patients smile. So use that kind of as a creative advantage with your creative going forward. Show those smiles when you can. Have your patients send in their smiles and use them on social media. And, of course, get their consent. You always want to be HIPAA compliant. I've got that here as the bottom bullet, but that's always something to be considerate of. And if you haven't before, look at your online reviews. Now is the time to see what people have said about you. If you haven't looked before, make sure you claim those Google Places pages. You take control of that And if you have time and you're in contact with your patients, encourage them to leave a review. It means it's like gold for a practice like yours. So keep that in mind and evaluate those things. So we next move on to public relations and what I call earned media. So this is a big part of my profession, where I go out and I pitch stories, but there's no reason why with little downtime as a practice owner, you can't do the same thing. Reach out to your local papers and talk about some of the things that they should be thinking about, their readers should be thinking about when they return to the office. It's great information. You're in a place where everyone needs you at some point. These reporters are being overwhelmed. Newspapers are being overwhelmed. Television stations as well, with all this content coming in, and they don't have that freedom to get out like they once used to. Position yourself as an expert and provide some content for them. They would love it, and they would come back to you over and over again. I can tell you daily, I've got television stories running throughout the Northeast with different clients of mine, pitching different angles on how they're dealing with COVID-19, and some great stories going forward. You might want to write your own blog post, present that as an article, an op-ed that can be used not only for a local newspaper, but also a newsletter to your patients. And as I mentioned before, trying out that video, put a video online on a newsletter to your patients and send it out. Let them know what's going on. Say hello to them. They'll appreciate that. They haven't seen you in quite some time. Another idea, participate in a webinar like this. Maybe it's a group of providers from your town, a pediatrician, a different type of medical professional. Put your own Zoom video together and talk about some content that people are wanting to talk about or listen to. And another great thing is really giving back to the community. You are part of the community. That's what you built your practice on. Don't forget that. So if you have extra masks, maybe you donate them to the local emergency room. Buy lunch for the local hospital. Send it to the ER. Even buy lunch for your own staff, but make a point of doing it from a local restaurant, showing that you're supporting your local community. These things go a long way. And when you put them on social media and you tell people what you're doing, they'll feel good about your practice and what they've come there and gotten to know to begin with. Now, if you're used to running paid campaigns, maybe in your market through cable TV, billboard, broadcast TV, now is the time to work with your local media outlets. I know money might be tight, but you'll stretch that money further than you ever have before. The media partners would be happy to go out there and put a package together that really works for you and goes a long way. Inventory has changed. We're at this point at the beginning of a new broadcast month. When things are open, we're heading into the summertime, your money will go a lot further. They're doing buy one, get one free radio and TV ads here locally. So there's an opportunity to really get your message out there and make sure you change that message to the audience. You're not running a commercial that you may have run back in November where everything was in a different place than they are now. So make sure you take into consideration that people are acting differently. That you may want to have some of your staff members in masks who weren't before, things like that. And if you don't have creative production, the TV stations, radio stations will really work with you and oftentimes give it away at this point to get you on the air. So remember that. And if you haven't used Facebook or Instagram or Google in the past, these are very user friendly. So take a look yourself, talk to maybe a local professional or even a younger member of your office or family member who is well versed in the social media world. But it's a great way to geo-target locally through some of these Facebook and Instagram outlets and reach your target audience. Again, reinforce safety. You want to make that part of every message you get out there to make your patients and their families feel safe. And maybe some of the new product lines you have coming out. If you've spent this time looking at maybe Botox or Invisalign, things that you haven't maybe put out there or promoted before, use this time to come up with that messaging. Let folks know that you now offer this, and something like Botox, maybe they haven't had in months, they would be lined up at your door to get once the opportunity comes up and your doors are back open. Some of the other things that we've talked about that really have evolved over the last few months are membership plans. So you'll see a large population now of folks coming back out, maybe that have lost their insurance, lost their jobs. Membership plans through your practice are a way to offer them affordable coverage and sometimes coverage even better than they've had before, but through your office. So with a membership plan, you would talk about that audience that is underinsured or uninsured, come up with some key bullet points to make these patients feel safe and feel like they're not turned away just because they might have lost their job or insurance coverage of whatever their situation may be. It's very important to kind of get out there and say, if you've been turned away somewhere else, or if you're worried about losing your dental coverage, we have a solution for you. And oftentimes it might be more affordable. Certainly for the practice, it can be a revenue generator. If done right, you can incentivize your employees. It's not something you want to put out there, obviously, and you're creative to the general public, but an opportunity like this, you can really spin into a positive. And I think that's what we're all looking to do as we get out of this hole and we come out of our homes. We want to turn what we can into a positive opportunity, generate more money, and bring in more patients.
Thanks, Pete. Marketing's a great subject, and I think the real importance behind the message here is marketing protects your revenue line. So it is an investment, and you're helping prevent revenue erosion, if not exceeding your revenue targets, by creating that awareness, by showing interest, and by connecting with the community. So great messages. Thanks for sharing your thoughts and your strategies around that. I've also formulated some questions here that I personally think that listeners will be particularly interested in, that I'd like you to answer. If we spend maybe 2-3 minutes just going through these before we wrap up. The first is, what would your focus be right now from a social media channel standpoint? Where should you invest your time?
That's a great question, Andrew. And I looked up just before we hopped on about the latest stats from April. And Facebook is at about 2.6 billion worldwide users. Instagram is about 1 billion. So without question, Facebook is really still the way to go. You have a lot more freedom with what you can do on Facebook, putting out messages, even setting up appointments through Facebook. As we said before, everyone needs a dentist. You're reaching a huge percentage of the population through Facebook. You're reaching the decision makers, the mothers who make the majority of those healthcare decisions in the home. And they make it very easy for you to do paid promotion out there. So we've had great success, even during these downtimes, of bringing in new patients, getting the word out about emergency procedures. And if you need that help, come in. Geo-targeting, income targeting. There are a lot of great ways to do that through Facebook. Things will change. We might have a different conversation here in 2 years, but right now, Facebook, if you haven't really gotten into it, that's the first place to start. Instagram is a natural progression from Facebook, but you're limited in what you can do.
Mm-hmm. Great. Okay. Thanks for that, Pete. So we know it's election year. What impact will that have on advertising this fall?
Oh, it's a great question. So from a media buying standpoint, it will have an impact. It probably will save a lot of the radio and TV stations who've had a tough hit. As an advertiser and consumer, you've probably felt like you've seen politicians a lot. You'll see a lot more of them as they will continue to buy up the remnant inventory. They'll pay a lot of money for those top spots and the primetime program, cable networks. Frankly, we probably won't see the rallies in person that we've seen. So that means more money will be going to broadcast TV. So each market's a little bit different. There's something called a political window that opens up, and it's sometime in July here in Rhode Island, in Providence, where I am now. So the best thing to do if you're concerned with that is talk to your local reps, find out what the situation is. There still will be inventory with other industries not being able to place money. So don't let them tell you that you need to pay top dollar when you probably won't, but it's good to have that conversation early.
Great, okay. So a question that I hear all the time at Practice Advisors 360, we spend a lot of time helping the practitioner find the right location. A lot of demographic work, competitive analysis work, narrowing down the location and then finding the property that matches the location. And what I hear from these practitioners often is, we've got the great location, we've got the great practice. Why do we need marketing? Because the location by itself sells. How would you respond to that question?
Sure. And they paid a lot of money for that great place, location. Well, what's the next thing a patient or consumer does after they drive by that beautiful location? Naturally, they look it up online, they check out the website. And if there's not a robust or a clean looking website, it doesn't need to be a $20,000 website. But if there's not something that matches the quality of your location, there's a bit of a question. We've gotten so programmed to go online and look at things. Oftentimes a website may be more important than the location. It's tough to say, but again, back to that, the first stat we had, about 80% of internet users go online to look at health related topics. You really need to start with a robust website. And then from there, look at your social media channels, things that won't cost you a lot of money, but get them up as well, so that they'll go from the website to your Facebook page. And once you have them feeling comfortable with that and an easy way to request an appointment, you'll be off and running. But don't disregard marketing and advertising just because you have a beautiful and a great location. They really do go hand in hand.
Yeah, and as you pointed out, consistency is key here in terms of perception and perspective. So yeah, great sound advice there. We've got time for one more question that I'd like to ask you. And clearly everyone's purse strings are a little tight at the moment. What's the most effective way to advertise and get that bang for buck?
That's another great question. We hear that all the time. What's the most efficient way? And from a marketing standpoint, we narrow it down to what's your best cost per thousand. So you can compare TV on broadcast to cable to billboard. So if you're a practice owner inundated by reps who come in and say, we've got the best deal for you, our cable spots are $5 a commercial, and on broadcast it's $500. Well, just ask them what the cost per thousand people. And when you compare those numbers, you'll get a very accurate number of what you're comparing. And in this digital age, if you're in a big city and you have one location, you might be outside of Boston, you don't need broadcast TV or radio. That you focus on digital. You want to focus on your neighborhoods that will be coming in. So look at that closely. And most of the reps out there are great people, but they have a job to do that sell your product. So when you ask them what's the cost per thousand, they'll take a step back and say, okay, this business owner has a little bit of an idea of what they're looking for, and you can make a calculated decision based on that information.
That's key. Comparing the apples to apples as opposed to chalk and cheese in this case. Great. Excellent, Pete. Thank you very much. Unfortunately, that's all we've got time for today. If you haven't already done so, please register for upcoming webinars on the link provided on this page. It will help ensure we keep you informed of the upcoming schedule. In addition, you can subscribe to the Practice Advisors 360 YouTube channel. A recording of this webinar will be placed there. In the meantime, if you have any questions or require advice, please reach Pete and the Practice Advisors 360 team on the email and phone number provided here. Thank you for your time today, and please stay tuned for information about our 10th Impact webinar.